Hey everybody, this is Art. We're at our first of the year 2024 Facebook Live. Thank you so much for joining. I hope you had a happy new year for 2024 and that 2023 was a successful year for you. If not, 2024 can be. This year can be better than last year. And that is certainly my hope for you, your family, friends, and loved ones. Today, we're going to talk about getting covered with healthcare. And we know that for many people, healthcare is not affordable and not available. But we will present to you today healthcare solutions that are both accessible and affordable. This is going to be from Dr. Trolley, who's our representative from Pennie, which is the health exchange provider in Pennsylvania. But before I do so, a few updates. First, we had a tremendous year this year in my office. I have a tremendous group of people who work with me, and I want to thank each of you for your support. We have created a year in review video. It's only 2 minutes, about 2 minutes long. I encourage you to look at it. It's on YouTube channel that we have created. It's YouTube at senatorhaywood.com. I hope that you will subscribe to this YouTube channel so you can see the year-end review as well as any other updates from my office. Now, in addition, unfortunately, I filed a complaint against my colleague, Senator Doug Mastriano, in connection with his conduct to overturn the 2020 election. I say unfortunate because his conduct was so unfortunate, but accountability is important. We know that from the public record that he was involved in setting up a bogus hearing to challenge the election results, that he asked for our state not to count all of the votes from Pennsylvania. They sent busloads of individuals down to January 6th. Some of those people, in fact, did get involved with the riot and unfortunately, all that happened on January 6th. And they continue to spread misinformation and what's been called the big lie with respect to the election. All of that undermines election integrity. He used his office as a senator to promote these lies. So we've asked the Senate Ethics Committee to investigate and make a determination about whether his conduct violates conduct required by state senators. And if so, should he be censored, reprimanded, or expelled? The conduct is all on the record, so it's not a lot of factual dispute about it. The real question is, what is the accountability that's required as a result of the conduct? Now, the Ethics Committee will make that determination along with all 50 members of the Pennsylvania State Senate. So that's some quick background on some recent activity. Strongly encourage you all to look at the year review. And we've got a lot of tremendous accomplishments, from getting support for infrastructure programs, for job training so our folks can get jobs, to reducing gun violence, particularly in the Northwest, and working with a number of partners to help get that done. I passed the guardianship law. Took a long time to get it done, but it will protect individuals who need the protection of guardianships, and much, much more that we were able to do in the past year. But that's the past year. We'll keep on striving in this year. On January the 11th, next week, next Thursday evening, we are going to have a virtual conversation about how to get enrolled in healthcare, to get covered. This is going to be with Pennie, and it's going to be from 4 to 6 p.m. I was going to say, I'm now going to introduce Dr. Trolley, who's going to share with us what's happening with Pennie and what are some of the healthcare solutions that Pennie has to make sure that people get accessible and affordable healthcare coverage. Dr. Trolley, thanks so much for joining us. Please take it away.
Thank you. Thank you for having Penny here and for the great introduction. Happy New Year, everyone. And, when thinking about the new year, one of the most important things that, from our perspective at Penny, you can do to make sure that you are protected in the new year, especially from unknown and unpredictable healthcare events or getting sick or injured, is to have health coverage. So I'm going to talk to you a little bit today about what you can get through Penny and what the affordable options we have that are for you. And then there'll be the event next week as well. So for anyone who's not familiar with Pennie, we are Pennsylvania's official health insurance marketplace. And that means that you can get high quality plans at the lowest cost. And those are really the two most important pieces about Pennie. We're not an insurance company. Sometimes people wonder if we are. What we do is we have health plans from all of the major insurance companies. And all of those health plans have to be comprehensive and provide important consumer protections. They have to cover care for pre-existing conditions. There's caps on how much you have to pay in a year towards your medical care if you get sick or injured. And importantly, Pennie is the only place to get financial savings to reduce the cost of those private health plans. So if you buy a health plan outside of Pennie, you first of all don't know and don't have a guarantee of the quality of the coverage. And second, you wouldn't get those financial reductions. And the financial savings can be very significant. They're based on how much you make, they're based on income. So they really are aimed at making the coverage significantly more affordable. And we see people every day coming in and enrolling. Pennie is really for people who don't have coverage through another source. So if you don't get it through your job or you don't have Medicaid or Medicare, then Pennie could have some really affordable options for you. So I'm happy to take some questions and go through more details about Pennie.
Thank you so much. And I have a number of questions. So we had a healthcare Pennie event before the end of the year. What is the deadline to enroll in order to get covered?
Yeah, it's a great question. We are in a very important time right now, which is open enrollment. So if you don't have coverage and you know you need it for 2024, open enrollment is the only time of year to enroll. So if you wait until you get sick or injured, it will be too late. And there's an important deadline coming up. Open enrollment is almost over. Normally, open enrollment ends January 15th, but we haven't announced it more broadly yet, but we are going to issue a special extension this year because Monday, January 15th is Martin Luther King Jr. Day. So we're actually going to extend open enrollment till that Friday, January 19th. So everyone has a little bit of extra time this year to go in, apply for those financial savings, and pick a plan that will work best to cover you and your family for the whole year. So January 19th is the really important deadline to know about. And again, if you wait till you get sick or injured later in the year, you'll have to wait until next open enrollment period, which doesn't start until November 1st, much, much later this year. So it's really important to enroll now. And even with that deadline being January 19th, we always encourage people to jump in there early. The phone line gets busy. Some of the in-person help we have gets really busy in those last few days. So if you want extra help and want some support going through the process, we have a lot of it, but encourage you to kind of take advantage of that as early as possible.
Thank you. Excuse me. So you mentioned phone lines. Can you tell us how to apply for the health care?
Yeah. So the first thing I'll say is you can do the entire application and enrollment process online. So that means you can apply, see how much financial savings you can receive, look at a lot of different plans from different health insurance companies, pick that plan and enroll online. But we know that the process can be complicated and sometimes people want extra help, have more questions to make sure that they're making choices that will work for them. And so we have a lot of help available as well. We do have a phone line, customer service representatives who are highly trained in the Pennie program and also can help you over to Medicaid if that's where, based on income, the best program for you. But they can answer a whole range of questions about Pennie. But we also have more than that. We have questions online, FAQs, and importantly, we have in-person help. So across the Commonwealth, you can go in, you can put in your zip code, and you can see people who are at community health centers, local health insurance agents and brokers in your community, where if you want to go in person and get that extra hand-holding, maybe it's a new process, you haven't looked at health plans before and had to pick one, those are resources that are there for you. And we have help in different languages and in many different forms. So lots of support to help people enroll.
Good. What's the phone number that individuals can call?
Sure, that is 844 eight four
Mm-hmm.
four 8040.
844-844-8040. So, hope our support, Wallace, if you can put that up on the screen, that would be extremely helpful so people can see 844-844-8040. Now, what's the website that people go to?
Sure, that's Pennie, PENNIE.com.
Great, great. We can share that as well. Now, if someone makes a call, would they also be able to, with the customer service folks, be able to say where to go for individual in-person assistance if that's requested?
Yep, so they can help if you call and you say, really would be easier to work in person with someone. They'll help find resources in your area. That's on pennie.com, but you can also call the customer service line to get help finding that in-person assistance.
That's fantastic. So you mentioned affordable plans, and you also mentioned financial savings. Let's first talk about the plans. What are the kinds of plans and what do these plans offer? Actually, what is a plan?
So a health plan is when you enroll in it, you pay a monthly premium, and what that gets you is that it covers, um, especially if you get really sick or injured, like in an accident, or if you break your leg, or if you unfortunately are diagnosed with cancer or a really significant health condition. If you have a health plan, it will pay for a lot of those medical services for you. If you pay for those things out of pocket, it can be tens of thousands of dollars. And we've seen, unfortunately, that people have gone into medical debt or even declared bankruptcy because of those medical bills after having to draw down all of their financial savings to try to pay for those services. So, what a health plan does is it protects you from having to pay significant costs towards your medical care. You do sometimes have to pay certain, co-pays, which means, $20 or $40 when you go to the doctor, or certain, lower amounts of um, payments. But when those really large tens of thousands of dollars of types of costs come from a medical injury or sickness, that's really where the health plan has its worth and really protects you from that financial hit. So plans through Pennie cover things like hospitalization, doctor's visits, maternity care, mental health services. And, it used to be that the health plan would cap how much they pay and you would have to pay the rest. But that's not the case anymore. Now, what you pay is limited. There's a cap on what you'd have to pay in a year, and then the health plan, the health insurance company has to pay the rest. So it really limits how much you would ever have to spend in a year if you have a really serious illness or injury. And that's sort of how it offers you that protection. I'd also note, it allows you to get those ongoing services to help manage different conditions, to help prevent them from getting worse. For example, with diabetes, being able to get prescription drugs and ongoing care to help prevent it from becoming more complicated. There's also free preventive services that are available, like wellness screenings and vaccinations, like the flu vaccine, that if you have a health plan, you can get those things for free and prevent small issues from becoming larger ones.
Thank you. Now let's keep going with these plans. Who are some of the providers of these plans that Pennie works with that an individual could end up with?
So it's a lot of well-known insurance companies. So you have companies like Independence Blue Cross, Highmark, Jefferson Health Plans. I'm sure I'm forgetting some. Cigna. There's a wide variety across the Commonwealth, and they really offer a variety of plans to offer consumers different choices. So there's some where you pay less every month, but maybe you pay a little bit more every time you go to the doctor. And then there's others that, you pay a little bit more each month, but when you go to the doctor or need to use services, you're paying less out of pocket. But there's a lot of choices also around what doctors they cover. So there's a tool on pennie.com where you can put in your doctor. Maybe it's someone you've been seeing for a long time. They really know you and your medical history. You can look before you even pick a plan to see that if that doctor is covered by that health plan, which means when you go to that doctor, you'll have to pay those lower costs in order to get that care.
Thank you. Before we get to the financial piece, sticking with the plans, I've heard there are different colors of these plans: gold, silver, something else. What's happening with the colors?
Yeah, so that's really the different levels of plans. So if you, for example, have gold, if you think of the Olympics, that's sort of the one of the one of the best ones. What that means is that it provides most coverage when you use care, but it does usually have, not always, but usually has a slightly higher monthly cost. So maybe instead of $100, you're paying $150 a month, or instead of 20, you're paying $40 a month. But when you go to the doctor, those costs are less. Another thing too, one type of financial savings, which I know we'll talk about in a minute, that Pennie provides is lowering the cost of what you pay when you go to the doctor or when you go to get a prescription drug or have medical services. And based on income, people who enroll through Pennie could be available for savings on those costs as well. And that's really only available if you buy a silver level plan. So that's sort of the middle plan. So people who enroll in silver typically pay less per month and might pay out of pocket more when they go to the doctor, except if they get those special financial savings. And in that case, those costs are lower too. So silver, we see a lot of enrollment in silver level plans because a lot of people look at that and think that that's a good mix of benefits for them. The relatively lower level of plan is the bronze. That also provides comprehensive benefits, but it does usually have a lower monthly cost, but you pay a little bit more when you go to the doctor. So it's all sort of about what you're comfortable with, what your budget can handle, kind of looking at your own household income and finances and what, everyone has a different approach to how they want to go about, um, you know, looking for a health plan, what will work best for them, and based on their healthcare needs and their family.
Yeah, that makes a lot of sense. So the plans have good coverage. You described the different coverage: doctors, hospital, prescriptions. So let's get down to the financial savings and the cost from it. I was been at a few of these events where people have walked out and they said, I got a plan that is $0 a month. I remember one event where individuals said they were paying something like 800 a month before, and then they walked out of the Pennie event and then they ended up paying like, I think it was 350 or something like that. It was less than half. So tell us a little more about the financial savings and how people can get them.
Yeah, absolutely. So that is one of the key parts about Pennie is that we have financial savings to lower the cost of coverage. And it's really based on your income. So if people aren't familiar, Medicaid is also based on income. So people who have Medicaids that qualify them, have incomes that qualify them for Medicaid, enroll in that program. But if you make too much for Medicaid, it's likely that you would qualify for financial savings through Pennie. And actually, many people who make incomes just above what would qualify for Medicaid are often the ones who see those $0, $1, $5 plans a month. And it's the same comprehensive coverage. It's not that the coverage is lower, it's just that the cost is lower for the same quality plan. And what you pay per month is based on what your family income is. So if you do make more, then you will be paying more towards that monthly premium. If you look for a plan outside Pennie, you could be paying 500, 600. If it's a family or couple, 800 to $1,000 a month. What we see people paying through Pennie is again like $0, $1, $80, $100. There's significant reductions. No one who comes in pays more than 8.5% of their income. And many people pay much less than that. And then the second,
That's a
that's the
keep
monthly
going. No,
part.
that's a great threshold. Keep going.
Yeah. And I was going to say, so that's to reduce the monthly cost. And then there are those additional financial savings for people on with, more on the lower income side that can also help with those out-of-pocket costs as well.
Nah, that's tremendous. So let's say I get a plan or someone gets a plan and then they need to go to a doctor's office for a visit. How do they know where to go? Is that part of the plan? Which physician is part of the plan? Which one's not?
Yeah, so each health insurance company works with different doctors and hospitals in the area to set up that relationship. So if you go to a doctor that they have a relationship with, that's called an in-network doctor. So maybe you'll pay $15 to see that doctor. If you go to a doctor that doesn't have a relationship with that insurance company, you could pay, $80 or $100. So it is important to check to see that the doctors that are important to you and that know your medical history and that you're really comfortable with, before you enroll, it's important to check that those doctors have a relationship with that insurance company, because that's how you're going to get those cost savings when you need care.
Thank you. So it sounds like once you go to Pennie and get enrolled, you select a plan. The amount you pay is based upon your income. It could be as low as zero. But in the end, you're matched up with an insurance company, United, um Independence Blue Cross, and then you're basically covered by an insurance company. You're not, if you got a problem with your plan, you don't call Pennie, you would call the insurance company. Is that basically how this works?
Yeah, so once you're covered, how to use the plan, if you don't already have a doctor, the health insurance company can usually help you find one. They can, recommend or give you a list of doctors that are in their network. And so you would go to them, to go through, how to set up appointments with doctors and how to pick one that's in network. I'll also note if sometimes people do have problems with their insurance companies where they think something should be covered and it's not. And that's where our colleagues at the Pennsylvania Insurance Department come in. They have a customer support center where if you are having a disagreement with the insurance company about what should be covered, they work regularly with consumers to make sure that you are getting the full benefit of your plan. So that's another resource that people have after they're enrolled, to make sure that they're getting the full benefit. But we don't see that a lot. A lot of times people have the coverage and they're able to get the services they need and are able to get that protection against high cost medical costs.
Now, thank you. I know some people are concerned about certain kind of assistance and the unfortunate stigma in the culture associated. Since individuals are getting plans from standard insurance companies, is there any chance of any kind of stigma associated with this enrollment?
I mean, the health plans are, private health coverage from larger insurance companies, and it's really kind of like any other health plan that you would get. It's really similar to employer coverage that you would get. You get the insurance card. Again, different hospitals and doctors, they have different relationships with all different types of companies. So um, that's why it's important to check. And that variation happens regardless. But I mean, it is sort of just like any other health plan that you would get if you went directly to an insurance company, for example. But if you go directly to them, you just don't get those financial savings, which is why it's helpful to go through Pennie.
And the financial savings are big. No, I got it. Um, so if someone wants to enroll online, what kind of documents do they need to have with them before they get in this process so they're not moving back and forth from their documents to the computer?
Yeah, well, the application we have, that's what you fill out before you enroll in a plan. And it really helps you. That's how we determine how much financial savings someone is eligible for. So through that process, it's helpful to have information that identifies you. So your driver's license or photo ID. Also, a social security number is important to have so we can verify citizenship as one of the eligibility requirements. But there are also many lawfully present immigration statuses that also qualify for Pennie coverage. So if you have a qualifying immigration status, you would want to make sure you have those documents on hand with all of those document numbers, because that will make the process go really smoothly. Because the financial savings are based on income, it's also helpful to have documents um, that help support and help you calculate your income. So whether that's pay stubs or a tax return from a prior year, those are helpful to have on hand as well. So you can put your income information in for your household. So it's not just for you, it's for your whole household. And then we can, as part of the application process, figure out how much financial savings you can receive.
Wow, I'm so glad you said that. So the household is everybody in your house.
Mhm. Yeah, so even if not everyone needs coverage, the application will ask questions about everyone in the family. And then it will ask sort of who's looking for coverage and who's not, but all of those different pieces go into the calculation.
Now, if you have a household, do you need the financial information for everybody in the household?
Yes, it's helpful to have social security numbers for people if they have them, have those at the ready, and income information for everyone in the household.
That's great. So we know the deadline's the 19th. We know the coverage is comprehensive and affordable. So on the 11th, when we have our virtual event, what should people expect?
Well, I think that event will help walk in more detail through what it takes to apply and picking a plan. So anyone who's interested in starting the process and finding out and getting more help directly on the details of the application and how to pick a plan, that would be a great event for anyone who's interested in learning more. And I'll also point out in the meantime, there is a quick way to know if you would get financial savings. So on the website, it's called the Savings Calculator, and you can just answer 3 questions about
Hmm.
your zip code, how many people are in your family, and your income. And it will give you a good idea just with those 3 questions. Very easy, takes 5 minutes, low commitment. Just with those 3 questions, you can get an idea of if you would qualify for financial savings. And then, if you want more information or need more assistance in sort of doing the full process of completing the application and picking a plan, the event next week would be a great one to go to get more information on the specifics and the details. And then that would hopefully get you on your way to picking a plan.
I'm really glad you've got those 3 questions. Do some quick triage, help people see if they need to keep going or they don't need to keep going. That's extremely helpful. So we're down to our last few minutes. You've answered every question that I've had, given, I think, a fantastic overview. We certainly want to encourage people to be on our virtual Pennie enrollment event on the 11th of January from 4 to 6. You can go to my website to get more information about how to make sure you're on that. Dr. Charlie, do you have any kind of final advice or comments that you'd like to share with those who may not have coverage, or they may know someone who's not covered?
Yeah, I mean, I think really one of the biggest challenges we have is that not a lot of people know about what Pennie has to offer. And so we do hear a lot from people who say they wish they had known about Pennie earlier because it is affordable, and they're surprised and relieved at how affordable it is and that they can have that protection from them and their families. So I think the last point would just be if you know someone who doesn't have coverage, or if you yourself, be sure to spread the word or ask or check around, and help get the word out, because it really does help people really maintain their quality of life, maintain those financial savings, and protect those financial savings that people have. And so I think really just sharing this information with others who might find it helpful. And then of course, don't wait. Open enrollment is that one time of year to enroll. There are, if you lose coverage during the year, you can get a special chance to enroll then. But if you just don't have coverage now, it really is that January 19th deadline is kind of your last chance to get in there for 2024. So don't wait. And we are here to help if there's any questions and support. And that event next week, where we're going to have trained assisters leading people through in great detail the application, I think is a great way to get that extra help as well.
Dr. Charlie, thank you so much for taking this leadership role with Pennie, first of all. We can certainly use all the leadership we can get. I really appreciate you taking on this role. Excuse me. For all who are listening, get covered. You can avoid the financial disaster that sometimes comes with this healthcare, these medical bills. You can avoid the financial disaster, avoid the financial risk by getting covered. It's not just for the money, for your health care. These preventative care visits can really get issues detected early, and the earlier diabetes or cancer or heart disease or anything else is detected, the earlier it can be treated. It really increases your chances. So get covered. Call now. And I'll give you the number again, 844-844-8040. Dr. Charlie, thank you so much. And we hope to see you again.
Thank you so much. Great being here.
Thanks. Thanks, everyone. Have a great week and hopefully see you on the 11th.